Hi, everybody. My name is Nick Merriam, and I am the CEO of sea.citi. We are a network of tech and innovation companies out promoting civic and community engagement together. We really have a lot of programming that focuses on tech folks here in the broader Seattle area. There's about 300,000 of them. And all of our programming is designed to help people get better connected to the community. We work with large tech companies such as Amazon, Facebook, Google, sort of the big tech that you would expect. We work with our friends in the mid-sized space as well, kind of the Tableaus, the Zillows, and we have a number of pre-IPO folks amongst our membership as well. I saw a number of Remitly people register for this event, so big shout out to our friends over at Remitly. For the last couple of weeks, we've been hosting these conversations every Thursday. This is our Roadmap to Recovery series, where we talk to leaders across different segments of community to really dive in and understand how COVID has been affecting our broader community with the shifts and changes and really a heavy focus on Black Lives Matter. We are starting to integrate conversations or questions also about structural racism into the conversation. So we are super pleased to have you here for these conversations. In the past couple of weeks, we've talked about transportation, sustainability, housing and homelessness. This week we're talking about immigration. Next week we'll be talking about the role of art, and just before 4th of July we'll be talking about education. So if this is content that you like, we encourage you to come back. We encourage you to share our invites with your friends, post them on the Twitter or on the Facebook or on whatever your favorite social media channel is. Do a TikTok about them, I guess. I'm still not on TikTok yet. So anyway, yeah, and thanks, Luanda. You can always tag us at SEA_CITI. So that is our handle across all platforms. So we are super excited about the conversation today. We're going to be talking about the impacts on from COVID on local immigration. And to do so, we are joined by Malou from the Northwest Immigrants' Right Project. She is the deputy director there, and she's been serving in that role since 2018. And prior to that, she was the supervising attorney in the Family Services Unit in Seattle. She also directly represented people in family-based visa petitions and defended people in removal proceedings. Her prior work before NWIRP, the shorthand for Northwest Immigrants' Right Project, in Moses Lake and Wenatchee offices focused on representing survivors of violence in rural Eastern Washington to obtain immigration relief. So Malou, thank you so much for joining us. I think the first thing that I would love for you to do is just give the audience a brief overview of the work of NWIRP and kind of what you guys are up to these days.
Yeah, well, first, thank you so much for inviting NWIRP to be part of these conversations and to join you. I think that the more we get to know our communities, I think that that's important as we're all connected. So I wanted to first give you thanks for inviting us. So Northwest Immigrant Rights Project was founded in 1984, so we've been around for quite a few years. We have you know, since the beginning, we've definitely been around to address inequities, situations where people are mostly impacted related to immigration. In the 1980s, when NWIRP first became an organization, it was called the Joint Legal Task Force. And we were working with communities from Central America here in Washington State who were facing high deportation numbers. Many of them were seeking asylum. And eventually, this task force became NWIRP. and it expanded beyond working with Central American communities. But as you know, it has come full circle where, again, the different communities that we serve kind of shift. But our work is to work with all immigrant communities. We serve about 19,000 people annually from over 160 different countries, speaking over or close to 70 languages. So our work has expanded. We have 4 offices in Washington State, one in Granger, which is in the Yakima Valley, one in Wenatchee in Chelan County. We have our Tacoma office. You may know that Tacoma houses one of the largest immigration prisons in the US. So we have an office there to work with people who are detained in immigration custody. We also have established a non-detained unit out of our Tacoma office to work with communities who are south of King County and on the coast. And then our Seattle office, which focuses on the western north part of the state. Our work is done through 3 different focus areas. Our bread and butter is direct legal services. We provide direct representation to individuals in their cases, both when someone is facing deportation proceedings and or when someone is not in deportation proceedings, but they're pursuing an immigration protection. And we also do this for detained and non-detained. So our second focus area is community education. We make sure that there is correct information out there to ensure that policies and practices that are constantly changing. Immigration law, as you may be aware, is very complex. So we want to make sure that the impacted community has the correct information. But part of our community education also involves working with lawyers. We have a large pro bono base of lawyers taking on cases. It also involves working with social service providers or educators, people like you, to ensure that we are having these conversations and that information is shared, that is correct information. And then our third focus area is systemic advocacy. You may be familiar with a lot of the lawsuits that NWIRP files. So our impact is beyond Washington State residents. We are, through our systemic advocacy work, either through litigation or even policy work, we work with community partners. It goes beyond Washington residents. So that's why we call it systemic advocacy, to make change systematically. And our work through our direct legal services, through our community education, informs our systemic advocacy. We would not be able to be doing this large work without doing the direct services. So just wanted to highlight that our work comes from different angles, but our goal is to continue to fight for justice by defending immigrant rights and working with the community at large.
Great, thanks. And I'm already gonna go off script. I'm terribly sorry. Like, I haven't even gotten to the first question, but I do just want to sort of note and recognize that over the last number of years, your organization has grown substantially. If I'm correct, like you've seen like a 3x or a 4x growth. So can you just give a broad sense of how many folks are you, like how fast did you grow over the last couple of years?
Yeah. So, and just a little background about myself. I started as an intern back in 2008 as a law student. And when I became a staff attorney in 2010, or a staff member in 2010 as a fellow, I think we were maybe like 35, 40 people, maybe even 50. Let's give that number. I'm not too sure. But right now we have, so that was back in 2010. In 2013, we started seeing an increase of more support. I think that's important because not only was the work and the demand and the needs of communities there, but there was also a lot of community support happening. And of course, in 2016, with all these changes, and in 2017, with the new administration, we saw a lot of support. There's also a lot of need in the community. So yes, our organization grew substantially, maybe 3 times its size. We are now about 120 staff. We have 60 attorneys across the organization and throughout our 4 offices. So yes, definitely have grown, and it's partly because of the needs and demands of communities who are experiencing a lot of attacks, but also because of the support that is out there in our communities.
Yeah. So getting into some of the content, I really want to start to understand kind of, can you just talk to us a little bit about the local impact of the pandemic on immigrant communities right now? And some of the stuff that I would imagine people on this call have already seen is that we're seeing higher cases of COVID being reported by news in specific racial and ethnic groups. Can you help us just start parsing out the nuance within this and help us understand sort of what's going on in immigrant communities right now as the pandemic comes, as stay-home orders sort of went in full force and are starting to get lifted, and layering in some of the economic impacts into that?
Yeah, and it's a lot, right? So I hope to touch on at least a little on everything. I know I'm not going to cover everything, but at least a little of everything that's going on. I think first, recognizing that even without the public health crisis, a lot of fear existed in communities. If a person is undocumented, accessing services would have already been limited. Understanding the different aspects of a person's life, including not just immigration status, but language, financial status, family status, like are they an individual or are they a family? All these different aspects of a person's life was already impacted, and we know that having lawful immigration status creates access. So for someone who's undocumented, there was already extra burdens or extra limitations. So with the public health crisis now, and I guess even before then, there were already changes happening in immigration law and policies and practices that were negatively impacting undocumented immigrant communities and documented immigrant communities. So now with the public health crisis, and now the economic impact, right, of people losing their jobs or people being asked to continue to work when there's a health concern. I think that we're seeing different experiences throughout the state. We know that the Latino community has been highly impacted. The percentages don't add up, right? And I'm not too sure of the percentages, but it's the highest impacted community, and it has one of the lowest percentages in Washington State as a community. So in Eastern Washington, in the Yakima County, we know, you may already know that there's a lot of workers striking, right? Demanding that employers recognize the health crisis that's going on. And then in the Wenatchee, Chelan Chelan Douglas County, we're seeing lawsuits happening asking the governor to reopen when the most impacted community members are not necessarily involved in those conversations. And so there's just a lot happening. We also are seeing a lot of solidarity and movement with the Black Lives Matter movement happening right now, and all this interconnectedness, understanding that the impact has been at different levels. There's mental health, there's financial impact, there's housing, there's food insecurity, there's definitely all these different services. Even NWIRP, since March 16, we've closed our offices physically, right? So no one is able to necessarily come in, walk in without a prior scheduled appointment. So access to services has also been limited for communities. And I think that and I may not be answering the question, but if we can think of something, it's just the realization that our lives are multifaceted, that there's more to just an immigration status or a medical need, that the immigration status also adds a layer of additional fear or insecurity for the communities that we represent.
No, and I think that's perfect. I think we're always trying to get beyond headlines in these conversations, and that was a very good sort of in-depth look at sort of both the structural pieces and the individual components that are affecting these communities right now. So can I just tease sort of one piece out here? And so knowing that the Hispanic communities have a higher rate of COVID, even though they're lower percentage of our state's population, expecting that getting proper healthcare early on in those situations, where do people that are undocumented go to even get healthcare, or do they just end up avoiding healthcare systems in general?
Yeah, no, that's a great question. We've been very fortunate that there has been clarification by the state to say that if it's a public health question, right, like where it might be related to COVID, access, regardless of a person's immigration status, is there. That there's testing, that there's follow-up. Clinics are helping people regardless of their immigration status if it's a concern around COVID-19. So the access is there. I think what's limiting people from going is that fear, which has been instilled in people's, even before the public health, right? We had policies like the public charge, if you're familiar with that, the new public charge rules, creating fear, and that was the intent. So all this fear that people already had, even when services are available, still prevents people from accessing those events. So there are services. There's so many publications and notices and announcements, and NWIRP has gone on Facebook Live to say, look, call the number. By calling the number, you will not be charged as a public charge. By seeking emergency services, this will not be considered public charge. So clarification, constant reminders, you can access this. This is available. This is available for you, regardless of your immigration status. So constant reminders, the fact that it is there for communities, however, does not change the fear that people have in accessing. And I think that is potentially also impacting the larger public health, right, and the larger communities. The public health crisis, COVID-19, there is no boundaries, there is no borders for that. Everyone may be impacted at some point. So constant reminders to the communities that there are services available and that it will not have an immigration impact or an impact on their immigration status necessarily by accessing these services continues. But the fear is what I think is preventing people from accessing these services.
Got it. So real quick reminder for folks that are on this call, if you do have a question, please send it over to Luanda right now. We have a couple of minutes left in the session. And before we take any questions from the audience, I'm gonna sort of pivot a little bit with the questioning, and this is gonna be a really broad question, but would love sort of maybe a 90-second answer on it, or a couple of minutes. But really, how do you see institutional and structural racism showing up in the immigration process? And do you see right now through your work any connections to the current community conversations about anti-Blackness and police brutality? I recognize those are like, those are day-long sessions, week-long sessions in and of themselves.
Yeah, no.
And I'm asking you to do it in 90 seconds.
And thank you for that. I think it's important that we engage in these conversations. As an immigrant rights organization, as an immigrant rights advocate, we recognize that the immigration system in the U.S. and across the world, any immigration system, but I'm going to focus on the U.S. system, is inherently racist. That we do work within this system, and that we try to change it, right? Even if we do individual cases or systemic impact litigation, like we're trying to change it, but we work within this system. So recognizing that, also recognizing that racial justice is part of our work. Definitely, the anti-Blackness sentiment is it's here in this immigration system. The Black community is definitely one of the highest targeted communities in the immigration context. Internally, NWIRP has also been engaging in conversations. We are publicly also showing our solidarity and recognizing that this is impacting everyone, that it is an interconnectedness movement, and that we can't continue our work without acknowledging everyone's connection, and that, you know, we are an anti-oppression organization, that we are committed to continue to fight against racism and injustices. And then we do this through our work because that's what we know how to do best, that we focus on the direct legal services, that we do the community education, and that we do the systemic advocacy. But all that recognizing the systems that we do work within, and that even if we change somebody's status or are able to help with someone individually, that we are making at least a dent on the system.
Yeah, thank you for that. One other quick question before we wrap up here, but it's expected that the Supreme Court is going to be ruling on DACA really soon, any moment. Can you just give a little bit of your guys' perspective on what you expect to happen with DACA, and maybe do the very, very brief overview of DACA for folks here? It's for people commonly referred to as dreamers.
Yeah. So DACA was first announced the previous administration with President Obama in 2012, and it allowed for people who had come to the U.S. before turning age 16 to seek a protection, which included protection from deportation and a work authorization that's given for 2 years. So it went on until 2017 when the current administration decided that it would terminate it within 30 days. And then there were a lot of lawsuits happening. Eventually, it made it to the Supreme Court, and the Supreme Court now is going to decide. And it could go, there's three potential scenarios. They're either going to decide whether they even have jurisdiction to decide to even hear this case. It could decide that the administration's move to terminate was unlawful, or it could decide that it was lawful, right? But whatever the court decides, and it could be as early as next Monday, June 15th. And interestingly, in 2012, when DACA was first announced, it was on June 15th. So it would be very symbolic if we have the Supreme Court's decision also on a June 15th this year. But the Supreme Court could decide whatever they decide. It will be up to the administration, right? And we won't know what the current administration will do, even regardless of what the Supreme Court decides. So that's going to be challenging. We as NWIRP, we are paying attention to what the demands are, what the asks are of impacted communities. We walk alongside. We are part of networks. We have been in conversations around coordinating the response. We will be providing a legal analysis of that decision, of the Supreme Court's decision, the day of the DACA decision. So we look forward to communicating the messaging and walking alongside the impacted community, just as we are walking alongside the current Black Lives Movement community.
Great. So the final piece as we wrap up here, we always like to leave participants with one or two actions that they can personally do today, tomorrow, in the next week, something that they can do to support immigrant communities. What would you recommend for them?
Thank you. Yeah, no, I think for all the communities that we belong to or that we care about, asking local jurisdictions to reduce police budgets, I think it's important, and to implement policies to minimize the arrest to deportation pipeline, right? Because our communities are impacted, right? And to ask that we show up, I think that's the first thing that we can do, to show up and walk alongside. If the impacted community is asking for whatever demands they are, that we recognize and hear their voices, that those voices are centered in our support as allies or accomplices, as people are now calling ourselves. And that we commit to working for improvement of communities, with working with immigrant stakeholders to further policies for protection and also financial support. In Washington State, there's a move for creating an unemployment insurance budget for people who are undocumented, right? Because you may have heard that with the first stimulus package, it did not allow for people to receive checks, right? Stimulus checks. But also for unemployment insurance purposes, undocumented people are not able to seek those benefits either. So we're asking locally, Washington State, if you do hear about any petitions or sign-ons, that you first read up about it, right? Familiarize yourself. Who's asking those demands? Is it part of the impacted community, right? Because we want to center those voices, and then consider joining the petitions or sign-ons.
Thank you. So we are slightly over time, and Malou, I just want to say a big thank you for joining us today. We really appreciate it. I saw a couple of additional questions coming in, and as Luanda just mentioned, we will follow up with resources in additional materials that'll get sent directly to you. We will also grab any outstanding questions and make sure we can either make a connection or get you some answers. So thank you everybody for coming. Like I said, next week we will be talking about the role of art during a pandemic, and we'll be talking to the Seattle Art Museum about that. So that is next week at noon. You can find the invite on our website and in our newsletter. So thank you all so much for coming today, and I wish you a wonderful and safe and healthy afternoon. Thanks. Bye.
Thank you, everyone.